Good afternoon and welcome to Bariatric Friday. Today is July 7th. This is our weekly bariatric event. Our goal is to bring the best of perfect blend of knowledge and expertise in these events as we speak on healthcare. Then without the expertise and people who are licensed to practice, it wouldn't be the right thing. So then that's why we have our surgeon, Dr. Isaias Irgau, with us. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Wonderful to be here. Yet another session of Bariatric Friday, one of my favorite sessions of the week.
Excellent. So glad that we are your favorite thing to do for the week. So now we discuss different topics for our patients who are in the process of getting bariatric surgery, but also we are the resource for those who may be in between, who hasn't decided on the surgery, and also like after surgery. There are still several different things that we have to do, and this is why we are here. And then one of the things that we do is we discuss these things in smaller topics, like one topic at a time. And today, actually, we are going to discuss morbid obesity and the sexual well-being. So the topic itself already is challenging for many people. No one wants to talk about sex, although everyone wants to have sex, right? Why? Was because, well, it's not just the physical activity, right? So when we said sex, this is why part of the well-being is important, because it lowers your blood pressure, better for immune system, lower heart disease, improves self-esteem, which many people in these days are struggling with depression. And this is, again, decreasing depression, increasing libido, the pain relief, and better sleep. So those are some benefits of having sex. Now, why we discuss this here is because patients who are going through the process and people who are, let's not call patients, people who are in the situation with struggling with morbid obesity, they are having these issues day to day. And there's a fix for this. So we want our people to be happier. We are here to provide better care, better outcome for them. And one issue is understanding what benefits we are getting. And it's not just like losing weight. It's not just this or that. It's so many different things altogether. And I wanted to actually include this in our topics, the discussions that we have every 3-4 months. Because we circulate them. So, Dr. Irgau, what do you have for us today? You're on mute.
How are we doing now?
Good.
Perfect. So, as you said, essentially, obesity by itself is a challenging topic. Not necessarily because we don't understand it as healthcare workers. It's because of, as we said in the past, the stigma associated with obesity is a topic that doesn't come very often or very easily when we discuss health with patients, right? And if you add to that another layer, which is sexual health, the problem becomes even more magnified, because that's another area which is very difficult to breach when you're discussing health problems with patients. But there is clearly a consequence of obesity on sexual health as well. As we said in many of our sessions, obesity is one of the leading causes of morbidity in our society right now. Up to 40 to 45% of Americans are said to suffer from obesity right now. And obesity is associated with the leading causes of mortality in our society, including cardiovascular disease, including metabolic diseases like diabetes, and other problems like sleep apnea or cancers, essentially. Obesity does affect sexual health as well in many ways, right? The first and most obvious way to look at that is that obesity leads to physical limitations that really curtail the actual enjoyment of sexual relationship, because at the heart of sexual relations, there is physical intimacy, right? So if excess fat, if excess weight within that person is going to limit their movement, is going to limit their flexibility, that is going to have an impact on their own experience and satisfaction with sexual relations. So the physical limitation itself of obesity can have a serious impact on sexual health, because once those issues start to come up, that actually impacts self-confidence. It creates a situation where the person is self-conscious about their own limited physicality, and that leads to really a lot of dissatisfaction or even anxiety about sexual relations itself, right? And then, of course, if you move beyond that, you talk about body image, right? People not being comfortable with their own body. And obviously, in sexual relations, you have to expose your own body. And if you do have discomfort with that image, that's going to decrease the confidence as well, which will lead to decreased desire, which will lead to more self-consciousness, and then obviously decrease the intimacy, which will really ruin, sexual relationship, and that will have an impact as well. But there are real problems as well, physiological problems. How about hormonal imbalances that are related to obesity, Kemal? Okay, those problems involve things like testosterone in men and estrogen, which are important hormones. Estrogen in women and testosterone in men. And that can affect things like libido. It can affect desire. It can affect sexual performance and functioning, essentially. And these hormonal imbalances are definite and real when it comes to obesity. So just by looking at, physical limitations, looking at body image issues and all hormonal imbalances, we can see how obesity can have a huge impact on the sexual health of the person.
So one of the things that I also heard about, like, some of the erectile dysfunction, like the ED issue, like some medications are not as effective because of the obesity. Is that true?
Absolutely, absolutely. So essentially with obesity, one of the problems we have, because it does affect our cardiovascular health as well, is we have decreased blood flow, and you have to have good blood flow for you to have good function of the sexual organs, right? So if that blood flow is affected, there is going to be erectile dysfunction, which essentially leads to inability to achieve erection and maintain erection in men as well, right? So that problem actually may be even more difficult to treat in men who suffer from obesity than the ones who don't. And that obviously is a huge challenge, because obviously it will have an effect on confidence, it will have an effect on the relationship itself, and then that creates anxiety. And as you can see, a vicious circle can initiate right now, where there are psychological problems, but also physical problems that are going to limit the person's enjoyment of sexual experience.
Sure. Can we actually talk about the puberty, like the onset date for puberty? How is that affecting? How is that affected by obesity?
So the very important thing to understand, Kemal, is that marked milestone changes, like puberty, for instance, which is a transition, from childhood to later teenage and then adulthood. Those are mediated by hormonal changes that are physiological changes, important hormonal changes that occur in our body, right? But obesity itself actually causes imbalance in our hormones, and that imbalance is reflected essentially in milestones like puberty, or in women menopause, where obesity will have a negative effect, either by making something like menopause occur much early in women, or delay puberty in young people.
So it's like only puberty it's delaying, it's not actually making it earlier, is it?
Delayed, yes. Yeah.
So, well, I think this all starts when people are younger, right? So, and those problems, we are carrying them over if we are not able to fix them. So there's always this issue of like how early we can actually have this surgery. If there's a patient who's 17-year-old who's morbidly obese, what are the chances for that person, or what's the best option for that person to get the surgery? But if they're not being taken care of in a timely manner, this is actually, they're going to actually inherit those issues for their older years.
Absolutely.
Right?
Absolutely. We know very well that children or adolescents who become morbidly obese or who become obese are very likely to carry on obesity later in their life. And of course, there is the impact of obesity itself in other aspects of growth and development in children and adolescents that are so negatively going to impact the maturation and growth of that young person. And in some extent, this is physical problems like diseases like type 2 diabetes, or sleep apnea that have an impact on the health of the young person, but also psychological problems. For instance, as we've talked in the past, one of the most common reasons for bullying in young adults or in adolescents is actually obesity. And that can have a negative impact on the self-confidence and on the image the youngsters can have. So definitely intervening very early when obesity is present in childhood and in adolescence is very important. And it has been demonstrated that in many programs where obesity is very extreme in young people and adolescents, actually bariatric surgery has a place in that situation as well. And there are specialized pediatric programs. For instance, there is one in our area at AID Point Hospital, Kemal, that we have actually been involved in developing in its early years that takes care of morbid obesity, even with surgical intervention, as you said, because early intervention is very important.
So the menopause is another challenging issue, and that's part of the sexual well-being as well. So what we know from the studies, those patients who are, as you said earlier, like they may be going into the menopause earlier, but also they are going to gain more weight during the menopause. Is that the case?
Absolutely. So menopause, essentially, it marks the end of the reproductive years of women, right? It's a biological milestone. At that time, the ovaries don't produce any eggs anymore, and there are many hormonal changes, including a decrease in estrogen. Now, the relationship between obesity and menopause, Kemal, is very complex, and it goes both ways. Menopause can affect obesity, and obesity can affect menopause as well. For instance, as you said, if obesity is already present, it's been shown that menopause tends to occur at a much earlier time in women who are obese as opposed to women who have a normal weight. Mm-hmm. But the fatty tissue itself, Kemal, when it accumulates in our body, it's not passive. It's actually a very active tissue that produces different types of hormones. And some of those hormones are actually including like estrogen. So when you have estrogen being produced by excess fat, that does create imbalance in the hormonal status of the woman that can lead to other problems as well. In other ways, you can see that, for instance, when women go to menopause, they do have menopause-related symptoms, but those symptoms tend to be much more intense when obesity is involved as well, whether it's hot flashes, whether it's night sweats, or mood swings. So obesity does have an impact not only on the onset of menopause, but also on the intensity of the symptoms that are related to menopause.
Sure. So going back to the men and the ED issue and the treatment options. So we know that, again, these are the things that are not being, every time someone wants to talk about this, they say, well, one of my friends is having these issues and then I need help, right? So we know that like the medications like Viagra and similar ones, they are very common. So it's because there is the issue of the ED with men. But what we are seeing here is it doesn't have the same impact on the person with the 27 BMI versus someone who's 47 BMI. That's what I understand. Is that correct?
Absolutely. And the reason for that, Kemal, is that the erectile dysfunction that is present in people who suffer from obesity has also multiple reasons, right? One, of course, is the fact that the blood flow is not optimal, because obesity itself does affect our cardiovascular health, as I said, right? So the blood flow to different parts on our body is not optimal when obesity is involved, because obesity is involved with cardiovascular disease. But also, we talked about the psychological impact of obesity when it comes to self-confidence, when it comes to body image, when it comes to flexibility. All those things will have an impact, because the erectile dysfunction is not just a question of dysfunctional blood flow, but there are all these other issues involved. So when you are trying to provide treatment, you're going to have much more challenge when the person is suffering from morbid obesity, as opposed to a person who is not.
So because the medicine is not just for this issue, but overall medicine is not by itself is the main tool to fight on these issues. So it can help, but it's going to have different impact on people based on their conditions.
Absolutely. I mean, if you have, circulation problems, if you have diabetes, if you have obesity, and you're suffering from erectile dysfunction, your responsiveness to medication is going to be different from somebody who has erectile dysfunction, let's say, because of blood flow issues at that time, right? And the medication may help with the blood flow, but the medication may not be able to help fully with a person who's suffering from morbid obesity, because of the multiple layers of problems that are actually causing the erectile dysfunction.
So let me ask you this. So what's the healthier number for those couples, married or not? So if they're a couple, how many times a week they should have sex? What's that healthy number?
That is a very, very difficult question to answer, Kemal, right?
I have a reason.
I think it should be obviously
3 times, maybe 4. Is it a lot?
Sure, pick a number.
Let's say 3 times, okay? So
sure.
Then I ask this question to my friends. So usually the answer is depressing. And I know maybe why with some cases, but the reason I'm asking is, let's say if this is 3 times a week, that's 3 out of 7. So when you look at the different challenges and the benefits of it, and what someone may be lacking, because how many people who are on Prozac or some type of anxiety, depression related drug. I mean, we run an ACO, Accountable Care Organization, 115,000 patients on primary care level. I know who's on what. Mm-hmm. And that's why when I actually come out of these issues a little bit strong, is because I know how common these problems are. And I know how much utilization of these medications are there, and also looking at the diagnosis, how quickly, how not quickly necessarily, but how common these diagnoses are. So issue is real. So when you look at it, when you know that someone's depression may be related to everything, but also related to morbid obesity and its challenges, which one of them is not being able to have, let's say, intimacy, right? So because they are not feeling comfortable, or when they are in action, they are not comfortable, just because everything is more difficult. So when you have a little bit belly, when you are trying to pick up something from the floor, guess what? You have to bend down a lot. So you can't just do what you used to do before. So because there are challenges. So that's why we are talking about these issues. So it's affecting organically, in a bad way, our life. So then we are saying that, look, for something that people should be able to do 3-4 times a week comfortably, now they're not able to do it. So it's not like something, if this was we just, like the other beings, and we were just mating 1 time a year, and then you're missing out on that, is one thing, but it's not, right? This is a activity, so then you are missing out. So then it's creating a lot of issues. So that's why it's important to, I think, discuss this.
Absolutely, absolutely. Obviously, the issue of sexual health doesn't only impact people with obesity. It is something that is by itself a topic that can affect people with normal weight or any weight, right? But what we're talking about is that the specific impact of obesity on sexual health. That's the point we're trying to make. And one of the issues that you raised, Kemal, or that we were talking about earlier on, is this issue of self-image, right? How do we see ourselves, right? Well, when we talk about obesity, from our point of view, as a disease come out, it has nothing to do with how a person looks. We're not interested in appearances. What we're talking about is the obesity itself has an impact on the health of the person, right?
Well,
Absolutely. There is another view of obesity that stigmatized obesity, but it is based just on the appearance issue. There is this notion about the thin person in America who is the desirable one, but that is not really based on the health, Kemal. It's based on this whatever promotion we want to give about somebody who is disciplined, somebody who works hard, and that image sticks to the person who is thin. And obviously, whenever we see somebody who is not thin, we disassociate those qualities from that person, right? So there is a self-image issue as well. And that self-image issue reflects itself on the person from a psychological point of view. One of the most distressing confessions we hear from our patients who struggle from morbid obesity, Kemal, is that they say, I don't want to expose to my partner my body any longer. I do not like my body. I want to hide it, right? When you are feeling this way about yourself, you're not going to have any intimacy at all, Kemal. And that really locks that person even more into an island, right? Where their relationship are fragmented, right? And they are essentially suffering in silence, right? Not only from the health problems related to obesity, but those psychological problems. But there is really an interaction also between the health problems and the psychological problems. And those interactions are no more visible than when we talk about sexual health, really, because you really need to have that psychological well-being and that physical well-being for you to have really the best satisfaction and the best enjoyment of sexual relationship.
No, that's again, we are focusing on the well-being. So life already has its own challenges, and when how we are preparing for it is the most important thing, right? So everyone is aging, so then how do we actually age is a little bit up to us. So how we eat, how much we exercise, what our choices are. But then there's also this next level of this issue where some of the modifications that I'm able to do or you are able to do on your own in your life, some people are not that lucky. And that's why we want people to focus on or take advantage of this most efficient tool to fight morbid obesity, because it's affecting every part of your life, every stage of your life, and it's either making it more like if you are able to fight and then get good resolution. And then we see, for those patients who may not be on the Facebook support group, they should sign up. We see real results on people and how happy they are. Absolutely. And then this is, today's topic is important for one of those happiness, the reason for happiness, but it's not, they're all tied into each other. So it's not like you can take this morbid obesity out of the sexual well-being. Someone may say, well, why is so important? Well, all the reasons that we talk about is so important.
Yeah.
But then usually when someone has morbid obesity, that comes with diabetes, that comes with hypertension, that comes with vascular disease, which is also making today's topic, sexual well-being, more impactful. So then if someone has vascular problems, they're going to have same issues. On top of that, they have the morbid obesity, that's going to make it 5 times more challenging. So, but morbid obesity is not something that we cannot fix.
Yeah.
So
Yes.
there is a very efficient tool, very effective tool, and that's the bariatric surgery. And I remember some patients who delay the process, Dr. Erkan, and they say, well, I don't want to give up on the way that I'm eating or the way that I'm having fun. Well, your BMI is 47, so you may not live so long with that BMI, or you may not have a really good quality of life long-term with that BMI. So that's why you need to start earlier. We are not saying that let's just cut the people by the age 5. No, that's not what we are saying. But if it's an adult who is already struggling with this issue, get help, because that's the only way that you can fix this problem.
Absolutely. So the central problem essentially is carrying excess weight. That is the main issue that we have. And of course, the levels that we are talking about right now, particularly when it comes to indications for bariatric surgery, we're talking about really high levels of excess weight. So a person who's about 80 pounds, 90 pounds, 100 pounds, 120 pounds and more weight than their ideal body weight. So if their ideal body weight, for instance, at a height of 5 foot 5 inches was supposed to be 150 pounds, if that person is 250 pounds right now, Kemal, that is what we call morbid obesity. And we're saying is that is the source of many ailments. We've talked about the high blood pressure, the diabetes, the sleep apnea, the cancers in other sessions. And today we're saying sexual health is also impacted like many other aspects of the person's health. And we're saying it doesn't have to be like that forever. There is treatment. And the vast majority of people who suffer from morbid obesity, Kemal, have tried time and time and time again, and they failed because the methods that they have tried are actually not working. And the reason they're not working is because they are struggling against a biology that drives a set point that defends it staunchly. So no matter how many times you try with diet and exercise, you come back even at a higher weight. What we're saying right now, bariatric surgery in the appropriate setting actually can do miracles, right? It has been brought to a level which is safe. It is performed in very high quality centers like ours right now, which with high safety, it can be provided. Obviously, other options and other treatments need to be on the table as well. It doesn't mean a person shouldn't exercise or shouldn't diet or shouldn't take medications for obesity. All those are very appropriate, but currently for very high levels of obesity, bariatric surgery is the most effective treatment we have. And it's important for people to know that availability. It should not be, morbid obesity should not be a death sentence for the person to carry on with a horrible quality of life for the rest of their years.
So, what we all know is this challenge is for all of us. So in my office right now, on the other side, I have New Direction diet robot.
Well done.
I'm not gonna have surgery, right? So, but I'm still like today. What time it is? So it's almost 4. So last food intake was 10 p.m.
Good.
So
Good.
10 a.m. That's 12, 14, over 16 hours. I have not eaten anything.
You've been drinking water though, right? Lots of water.
So, okay. Now, this is life.
Yeah.
And what I'm going to eat right now after this session is one of the robot puddings and maybe one of the bars, I don't know. But what we are trying to say is that we have to do this. And now I walk 3 to 4 miles every day. And for me to maintain or lose weight, maintaining is one thing, but losing weight is only going to happen if I'm really putting extra effort. Because with the age, it's getting more difficult. So, but I'm not going to have surgery in 2 months. But still, every day I'm doing this diet. Not only that, I put those people out there, they're on diet with me now, because that's the only way. So get your other close friends and family members to support, because if they're not there supporting, that's not going to happen. And we all decided, okay, so this is what we are going to do. We have to take it seriously. But this is affecting all of us. And I can tell you, To a point, it does help and it works, but it's tough.
Yes.
It's not easy. So without medication, without this or that, this is how it is. So now when I'm looking at trying to see this from a very different BMI level, life can be so difficult if you don't find a quick solution. So that's all we are trying to say.
Let me ask you, if I may, Kemal. So how many pounds you think you need to lose to be comfortable yourself?
I put extra 20 pounds since the pandemic.
So look at how much effort you're making to lose 20 pounds. Imagine how much more effort is required if a person needs to lose 150 pounds, if they need to 160 pounds, right? That is tremendous. It is almost nearly impossible for a person to do it without significant help to do that, right? And that's where we're saying that bariatric surgery is very important.
That's one part, right? How difficult it is when they're young. Yeah. But what I'm telling our patients, what I'm trying to tell our patients is, you are not a victim. So even if we are not going to get the bariatric surgery, like people like us, I know you are doing the same diet that I'm doing. We don't eat.
Right.
Monday through Friday, no food during the day, after 10 p.m. night before, until 2 or 4 p.m. depending on the day, we don't eat. So, and I mean, your BMI probably is better than mine, but you know how this is. This is true for all of us. My dad doesn't eat.
Yeah.
Not because he cannot afford, but he chooses not to, and he's a healthy 82-year-old.
Look at that. That's a blessing, right? I've seen his pictures swimming. Is it last summer that he was swimming in the middle of a sea or a lake? I mean, look at that energy. And that's
because you want to have longevity of life, not necessarily you want to live so great until you are 37 and then you are miserable. That's one of the issues that we have with these people who are trying to normalize and celebrate morbid obesity. That's not what we are here for. So we want to help people who are looking for solutions, and that's why we are here. And hopefully this is reaching out to more and more people, and we'll be back next week. Next week we are going to start a new cycle. So bariatric surgery type, I believe, is going to be our first one. So those who have not decided what type of surgery you are getting, next week's session will be a good, important one for all of us, all of you. So we'll see you next week. Dr. Ria, thank you so much.
Thank you, Kemal. Have a good day. Bye-bye.